Hi, everyone. Thank you for joining us today. I want to start by welcoming our viewers. This is our very first episode of Hot Topics at Peninsula Plastic Surgery. My name is Carrie Holloway. I'm the nurse practitioner at Peninsula Plastic Surgery, and I have with me Doctors Parada and Pellegrino. They are both board certified plastic surgeons and are active members of the American Society of Plastic Surgeons and the American Society of Aesthetic Plastic Surgeons. Please feel free to leave any comments or questions below, and we will get back to you in a timely fashion. You can also reach out to us via our website and feel free to schedule a consult. Today, we're going to discuss facelifts. So let's dive in. Most of our facelifts are performed in our very own private operating room, the Center for Aesthetic Surgery. It's attached to our Salisbury office. A facelift is a surgical procedure that will improve visible signs of aging in the face and the neck. Facelifts are sometimes combined with other procedures, such as brow lift or eyelid surgery to help rejuvenate the eyes, fat transfer or fillers to replace lost volume, or in combination with skincare, lasers, and peels to improve the texture of the skin. Dr. Prada, I'm going to let you take it from here.
Okay. When most women or men come in to see us about a facelift, they're concerned about mainly two areas. The jowls, which are right here, and then the neck, which is right here. And you can see on the picture there, that lady has jowls, and she has what some call a turkey gobbler deformity. With a mini facelift or a facelift, we're able to totally obliterate the jowl. And with a full facelift and neck lift, we're able to take care of that turkey gobbler deformity. The mini facelift helps, and Dr. Pellegrino will get into that later, but it doesn't always completely smoothen the neck as does a full facelift or neck lift. Here you can see a patient that underwent a full facelift. You can see that her jowl is completely gone and her neck skin is smooth and tight.
Dr. Prada, for the purpose of this presentation, I'm going to act as a patient and ask some common questions that we receive.
Okay.
When you're speaking a full facelift versus a mini facelift, are there any difference between the upper part of the face? Do you do anything with the brows?
Usually not. However, during either a full facelift or a mini facelift, we do redrape the skin at the temple, and that could pull the eyebrow a little lateral or toward the outside, which makes it appear a little higher, but not much. It's not a full brow lift. A brow lift is a separate procedure, but it could be performed at the same time simultaneously. Here's a gentleman we did a full facelift on, and you could see that his jowl is gone and his neck is tighter. He didn't really have a turkey gobbler deformity, but you can see now how deep his mandibular line, how deep his mandibular line is and how well defined it is. That's what he was after. You could also see that his cheeks are well established. Before a full facelift, most patients have their cheek kind of splayed out the whole side of the face all the way down to here. But after the lifting procedure, we concentrate the cheek up here where it should be. You can see that in him as well. Here's another example of a patient we did a full facelift on. You can see the preoperative pictures up top, and below each one is the postoperative picture. The first one on your left shows the oblique view. You can see that her jowl is gone. Her mandibular line is very well defined. In the center picture or center column, you can see the same. In particular there, you can see how well her cheeks are reestablished and full. You can also see that her neck is smooth. On the column to the right, you can see her, again, her jowls are taken care of and her mandibular line is very well defined. What's most interesting about this case is how she looked when she came to see us. In her preoperative pictures, the ones on top, you could tell she takes care of herself, but when you look down below, you could tell that she probably found the best salon around to take care of her hair and her makeup.
I think this is really impressive. It almost looks like mother-daughter.
It almost does, and we did not prompt her to fix her hair anyway or to put on extra makeup for her post-op pictures. We just told her post-op pictures were going to be on a certain date, and this is how she came in. It tells you how she feels inside.
Right, it boosts her confidence for sure.
Here's another patient we did the full facelift on. Again, the preoperative pictures are on the top, and the post-operative pictures are on the bottom. On the left side, you can see the oblique view, that column, preoperative on top, post-operative on the bottom. Her jowls are taken care of. Her neckline is smoother. She still has a wisp of a platysma band here down low on her neck, but it doesn't bother her a bit. She's very happy with this result. In the middle column, you can see the preoperative picture, and it really shows those bands along the neck. See those two bands right in the middle? In the postoperative picture, you can see that they're gone. On the column on the right, you can see that the neck's improved. There's still a little wisp of skin, but again, it doesn't bother her. She's happy with the result.
This mentions that the patient had CO2 laser. What was that for?
We performed CO2 laser to do two things, or three things really. One is to tighten the skin. Two is to correct any pigment irregularity. And three is to greatly improve or obliterate wrinkles. The CO2 laser obliterates or vaporizes the top layers of skin. And then the body's normal processes of wound healing kick in to make new skin. And if there's pigment irregularity on those top layers of skin, then that pigment irregularity comes off with the skin as the patient sloughs.
I'm really impressed with the lines around her mouth from her laser treatment.
It's kind of hard to see it with this view. I really can appreciate that in the pictures there, but it did make a lot of improvement. Another patient, preoperative pictures are on the top, post-operative pictures are on the bottom. When I say preoperative, pre means before the surgery, post means after the surgery. I should have defined that earlier. But you can see in her preoperative pictures, let's look at the left column. Again, you can see the jowl there. And she has an ill-defined mandibular line. But if you look at the post-operative picture on the bottom, below it, her mandibular line is very well defined. And her neck is improved. Also, look how well her cheeks came out. Look at her cheek on the preoperative picture. Actually, go to the one on the left, the column on the left. Mm-hmm. You can see it's splayed out over the whole side of her face, her cheek.
Yeah.
You can't really tell where it is. But if you look on the bottom, it's right where it should be.
Yeah, this is a great result. I know she was very happy.
She's very happy and loved being one of our models.
Yeah.
Another procedure, same procedure. If you look at the column on the left, she had the jowls, she had the skin laxity on the neck. And again, it's actually, we have a problem with the pre and post-op lineup here. Oh, this is just the opposite. On this set of pictures, the preoperative pictures are on the left and the post-operative pictures are on the right. Okay, so let's look at the row on the top row. Preoperative picture, you can see she has some jowls, jowl there, and skin laxity on the neck. Her cheek is gone. She has no cheek, basically. Now, if you look on the right, look at that cheek, beautiful cheek. And her mandibular line, very well defined. The neck is svelte. Yeah, she's very happy. If you go down to the bottom row, again, you could see the jowls, and they just continue with the excess neck skin. There's really no demarcation at all between her mandibular line, or between her face and her neck on the side there. It just kind of continues. But on the right side, you can see everything's well defined and demarcated. And the cheeks are well established.
What is the downtime for a full facelift?
The stitches come out in 7 days usually, and we tell patients they should feel comfortable to go out to dinner and be seen in public in 3 weeks.
Do the patients have drains after this type of procedure?
For a full facelift, we usually put drains in and we take them out the day after, or 2 days after.
I know from my experience following up with some of these patients, I will say I'm always impressed. They have little to no pain when I see them, and that's 2 to 3 days after their surgery.
That is true. And we think that's because the face sits on the head. It really doesn't have to hold anything up or support the body. It just sits on the head. So if the patient walks around, she's not stressing her face at all. And we think that's why there's little pain. It just kind of sits there on the head.
We're going to move on to mini facelift. Is there anything else you'd like to add about full facelift?
Not really.
Okay. And certainly if anyone has, again, questions or comments, please feel free to leave those below and we'll be happy to get back to you. So moving on to our mini facelift, I think it's important that we mention a lot of our mini facelifts now are being done under local. Again, it's in the privacy of our own OR, but it does help those patients who have medical conditions that can't necessarily tolerate anesthesia. This is a great option. So Dr. Pellegrino, I'm going to go ahead and hand it over to you.
Okay, yes, the mini facelift really came about. It evolved from a full facelift. Patients were really looking for even less of a recovery time, quicker return to work, and nice results. And the mini facelift, I think, delivers on a lot of these, the desires of the patient. We say mini because the scars are shorter than a traditional facelift. We usually go around the sideburn, starting right there on the temple, curving down around the sideburn, and then follows the hollow in front of the ear. And I usually end it at the earlobe or just slightly behind the earlobe. Whereas the traditional facelift, we would make scars all the way behind the ear onto the scalp. And that scar can sometimes be wide and unsightly at times. The operative time has been cut in half from traditional facelifts. The pain level, as you mentioned before, it's really nominal pain. And again, patients the downtime is on the order of a few days versus weeks. These are some representative examples of patients who just had the mini facelift. And this patient does show that the before is on the left, and after is on the right. You could see the scars are looking good. The cheeks that Dr. Parada was talking about, that it almost gives the appearance of a nice higher cheekbone, because we do take some of the connective tissue, the so-called SMAS, and we resuspend that under the skin right along the cheekbone. And it does also improve the appearance of the neck. The jowls are improved, the neck is improved. And this is a good example of it. Another example of a mini facelift of Dr. Parada's. Again, you can see those areas that are improved. The jowls are definitely improved. The neck contour is improved. Cheeks look better. The scars are very, very well hidden, and they generally heal very nicely.
At what age would you recommend a mini facelift versus a full facelift, or are there other factors that you're considering?
I think the mini facelift, we're actually applying it to actually a bit younger patients than we used to apply to the full facelift to. I'm starting to see patients come in their mid to late 40s now, into their 50s, even 60s. Now, I have patients who are in really good shape that are in their 80s that have had this procedure. But I would say women and men start to seek this type of procedure late 40s to 50s. That's probably our average, right? Late 50s is probably average for all comers. Another example of a patient, you could see the jowl. It really targets the jowl. The mini facelift, I tell my patients, think of it as really improving the lower half to lower 1/3 of the face. Again, it doesn't rejuvenate the periorbital or the around the eye region at all. But patients sometimes do opt for eyelid surgery or brow lift surgery at the same time as a mini facelift. But I was going to say the straightforward mini facelift, probably right around 2 hours we're looking at under very light anesthesia.
If a patient did decide to do something like a mini facelift, but they had a lot of the perioral lines, some patients will refer to them as smoker lines, would they be able to do the combination therapy like we saw with Dr. Parada's patient with the CO2 laser?
Yes, that's a common scenario where we would do a mini facelift, and right after we're done with the patient still under a light anesthesia, we could do the laser resurfacing at that same time. So that adds a nice touch. That CO2 laser really adds a nice touch in patients with deep lines around the mouth. Here's an example of a patient. She really didn't like the way her neck looked, but she also had a fair amount of improvement in those lines on the cheek there. You could see those deeper lines cheeks, so that it did smooth those out, cleaned up the jawline. You can see her mandible. See the angle of the mandible? Yeah, right there. That looks a whole lot cleaner. And even the neck looks good. Now, Dr. Parada mentioned the platysmal bands. If somebody has really prominent platysmal bands, we can open up a little incision under the chin and alter those at the time of a mini facelift. But I find a lot of my patients with mild banding, they do well with just the mini facelift without even touching or going into an incision in the neck.
Yeah, this is another great result, especially, you know, just for a mini facelift.
Right, this is just the mini. Again, you can see, I mean, this procedure really gives a lot of bang for the buck, I think, for a 2-hour procedure. Patients really seem to like the results. They like the recovery, they like the downtime. A few more examples here. Yeah. Now, you could see on that last patient, a lot of these patients, especially depending on their age, they have a lot of sun damage in their skin. So a really important adjunct to a facelift, we really promote skincare. And we do have the Renaissance Spa and an excellent staff there. So we talk about this with every patient. If you're going to go through the, the recovery and the expense of a surgical procedure, it really pays dividends to get on a good skincare regimen.
How long do the results of a mini facelift last?
And generally, I would say at least 5 to 10 years. Sometimes we see patients down the road years after a mini lift, and we could actually repeat a mini facelift. That's a common scenario. Another patient population that I sometimes see is patient 15 years ago had a full facelift, and now they're a little bit older, a little bit maybe not as in good condition medically. So a mini facelift is a really nice alternative. A short 2-hour procedure under local anesthesia or light sedation. It's a very safe alternative in somebody who wants that rejuvenation.
So I think that it concludes our before and after photos. Do either of you have anything you'd like to add about things that you are commonly asked for this type of procedure, or anything related to facelift, recovery, the results?
I think maybe it might be helpful to just summarize the difference between the two.
Do you want to go ahead and do that?
Yeah, I could do it, and then Dr. Pellegrino could give his perspective
Okay.
about this. I think if a woman is more interested in her lower face, like Dr. Pellegrino said, there's nothing better for it. It's amazing how it improves the lower face. So I would say if it's her lower face she's most interested in, I would say the mini facelift is the procedure of choice. If it's the neck, in addition to lower face, then I think she needs a full facelift, and or incrementally at different dates, a mini facelift and then a neck lift. And there's some advantages of having things done incrementally, mainly that we could do them with local anesthetic alone and some oral sedative medication rather than anesthesia. For a full facelift, I would say, I think Dr. Pellegrino would agree, most patients would require anesthesia, but if you could break that up, patients could undergo 2 procedures and have the same effect of a full facelift with local anesthetic alone. And that would be the mini facelift, followed by some time by a neck lift.
I think that's a great point.
Yeah. Yes, the anesthesia we use, it's really remarkable. I wasn't a believer until I started doing these surgeries under a light sedation. And by the time the patient's in the recovery room, they are sitting up, talking, having a drink, and the pain is nominal. There's very little nausea, vomiting, and other side effects. So yes, that point is well taken. It's I think a very safe way to do the surgery. But going back to the neck, this procedure, the mini facelift, has a very high satisfaction rate, I would say. The few times I've been not that happy is if the patient has that big hanging excess skin of the neck. The mini face, that's where it does fall short, I would say. And those patients would require a formal neck lift or more scarring around the ear and behind the ear. And
I would agree. I think when I perform a mini facelift and there's an unhappy patient, it's because the procedure didn't improve the neck enough. Even though we told them preoperatively that it probably wouldn't, I think patients don't hear everything sometimes. And so they go into it believing that, or overestimating the amount of improvement on the neck a mini facelift will provide.
I think that's a great point, and I always encourage our patients to, bring a significant other or a friend, because that person usually picks up on what they're not listening to. And it's also good for our patients to take notes and, give us a call if they have any questions. All right. Well, I just want to thank everyone for tuning in to our very first episode. Please feel free to leave any feedback below and follow us on all of our social media handles so you can stay up to date on any of our monthly specials that we may be having. And because you took the time to watch this video, we wanted to extend a complimentary facelift consult with a complimentary ZO Skin Health gift, which is valid till the end of December. And we look forward to meeting you.
Thanks, Carrie.
Thank you, everyone. Have a good night.
Thank you.